Good afternoon. Welcome. I'm Holly Wimstad. I'm the Director of the Bureau of Disability Services and want to welcome you to the Provider and Case Management webinar. Next slide, please. Right. You will see in the Q&A some links and things that will be placed in there that will tell you how to sign up for DDRS bulletins and other communications and DDRS announcements. So keep an eye on that area. All right. Before we get started, I want to talk about how to use live captions. To turn on live captions and subtitles, select Caption Subtitles in your video controls. And then to change the caption language, select Settings, Caption Subtitles, and then choose the language you want. So we are really glad you're choosing to spend some of your day with us today. In an effort to more fully respond to questions during these monthly provider and case management webinars, we're increasing the amount of time that we're spending on questions during the actual webinar. We'll continue to address case-specific concerns outside of the webinars, but please submit any questions you have from today's webinar to beadshelp@fssa.in.com. And we will review those questions you submit and then provide them with responses in a future webinar. Today, our agenda is very similar to what we typically do. We'll do updates for all providers, an update for health and wellness and traumatic brain injury waiver providers. Not when I say providers, that's inclusive of case managers. And then we'll do updates for the community integration, habilitation, and family supports waiver providers, including, shall we say, a guest speaker, Jessica Harlan York, our division's Chief Operating Officer, will talk about the home and community support professional training. And then we'll go over some questions and answers from May last month, and then again do the invitation for future webinar topics. All right, so provider updates for all providers and case managers is where we'll start today. Want to go over a few IHCP bulletins. Just as a reminder, there are I hope as providers that you are aware of IHCP bulletins and how to access those and how to sign up for those when they are sent out, but also where the site to go to look for them. So we have included some links here for your reference, but IHCP issued bulletin number BT 202577, reminding HCBS waiver providers of certification and enrollment guidelines. So this particular bulletin is applicable for all Indiana Pathways for Aging, Health and Wellness, Traumatic Brain Injury, Community Integration and Habilitation, and Family Support Waiver providers. Can we go to the next slide? And it talks about the fact that an HCBS waiver provider that experiences a service location change must contact the certifying FSSA division and receive an updated certification prior to updating their provider profile information with Gainwell Technologies. And Gainwell Technologies, is an Indiana vendor, as you know, and this will ensure that the provider is giving Gainwell the updated certification letter that reflects the provider's service location change. So Gainwell will need that to make that change in the system. The certifying FSSA division for health and wellness and traumatic brain injury waivers is the Office of Medicaid Policy and Planning. And OMPP utilizes an online provider certification portal, and we've included the link to that portal. So if you are a provider for the health and wellness and TBI waivers, OMPP utilizes that online provider certification portal. And then for providers interacting with the OMPP certification portal for the first time during an address change, all previously certified services and provider policies and procedures will be reviewed to ensure appropriate compliance with HCBS regulations. Any future address changes will be considered demographic updates without a full review. So if it's your first time using OMPP's certification portal, you will, we in OMPP will review your policies and procedures. Once you have used that portal once and you just need to do an address change, it's just a demographic update. The certifying FSSA division for the CIH and Family Supports Waiver is BEADS, the Bureau of Disability Services. And you can reach out to our provider services at the email listed here, which is bdsproviderservices@fssa.in.gov. Now, providers may also request a profile update in the BEADS portal, and BEADS will review the request, and upon approving the request, we'll be able to issue an updated certification letter. That certification letter is what is required to complete the address change with Gainwell. All right, again, if you have questions about that, we would refer you to that bulletin as well. Want to include a reminder about incident reporting. We have indeed seen a rise in incident reports being submitted late. So an initial report must be filed within 24 hours of a staff member becoming aware of or receiving information about an incident. So this means the 24-hour time frame begins at the point that any employee of a provider agency first learns of the incident, not when the person responsible for submitting the report becomes aware. So Adult Protective Services is going through a bit of a transition on July 1st. The prosecutors will discontinue as Indiana's Adult Protective Services contractor on June 30th of this year. Just a few short days away. Hard to believe June's almost over. The model for Adult Protective Services in Indiana is transitioning from a criminal justice model as it exists today to more of a social service model on July 1st. Now, PCG, which stands for Public Consulting Group, will be the contracted entity to operate Indiana's Adult Protective Services. The hotline number, reporting website, and the email for Adult Protective Services will remain the same. So the Adult Protective Services remains with the Division of Aging. So just as a point of clarification, you will see some changes with Adult Protective Services come July 1st, but again, the hotline number, the reporting website, and the email will remain the same. All right, we have a save the date for you. So the 2025 Indiana Health Coverage Programs, or IHCP Works Annual Seminar, is being held Tuesday through Thursday, October 21st through 23rd at the Embassy Suites, located at 6089 Clarks Creek Road in Plainfield. The annual seminar will include educational information presented by several IHCP partners on topics such as prior authorization, claims, provider enrollment, behavioral health, and waiver services. So please watch for an upcoming IHCP publication with more details, including session descriptions, session times, hotel reservation information, and event registration. All right. CAMS and BEADS portal access. So all of you are likely aware that on July 1st, we are implementing the functionality for the health and wellness and traumatic brain injury waivers from CAMS, the current IT system used for those waivers, to the BEADS portal. As we move towards that, moving that functionality, that transition, both CAMS and the BEADS portal will be unavailable due to this maintenance and transition from Friday. Oh, I'm sorry, that is incorrect. That is Friday, June 26th at 4 p.m. or 5 p.m. through Tuesday, July 1st at opening of business around 8 a.m. So apologies for that. It actually is the June 26th. The scheduled maintenance will complete the next steps in the BEAD system consolidation project to modernize information technology systems. The existing BEADS technology systems have been enhanced to incorporate the health and wellness and traumatic brain injury waivers. We're very excited about this. You know, as you know, if you have worked with BEADS for any period of time, we have placed a lot of focus on trying to consolidate our IT systems for a number of reasons. Efficiency is one, but it's also increased transparency for those partners we have in supporting individuals and families. So there's other reasons as well, but those are two of the big reasons why we continue to work towards consolidating our IT systems. Resources and materials to support this endeavor have been developed. Trainings occurred with case managers and state staff throughout this month of June. If you encounter an issue with the system, after the system is back online on July 1st, please submit a JIRA ticket. I do want to note that for providers on the health and wellness and traumatic brain injury waivers, we will be working towards further enhancements for you so that you will have increased access to your agency's profile in the BEADS portal, but that is future state. Just know that we are working towards that so that you will have access to your provider profile in the future. So yeah, stay tuned for that one. Next slide, please. So I want to provide an update on some waiver amendments and renewals that we submitted. So earlier this year in 2025, we issued a public notice on the intent to submit amendments for the health and wellness and traumatic brain injury waivers, as well as renewals for the family support and community integration habilitation waivers. So those amendments on the health and wellness and TBI were submitted actually on Valentine's Day to CMS for review. And you may recall that one of the major components of those amendments was the implementation of the level of care assessment representative on July 1st. And then we submitted renewals for the FS and CIH in March. Those amendments and renewals have been approved and are effective beginning July. The health and wellness and TBI waiver amendments are effective July 1, and the renewals for the family support and the CIH waivers is mid-July. All right, we are going to switch gears now to go over some provider updates for the health and wellness and TBI waivers. As we all know, choice is a cornerstone of home and community-based services. So it is important to remember that all individuals receiving waiver supports and services are to be offered choice regarding what approved provider they wish to provide their services. And this applies to all HCBS services. It's sometimes natural when we're talking with individuals and families to think of those providers that we work with the most or more often, or that we're familiar with. However, we have to ensure that individuals are aware of their provider options and that we are supporting them to determine the best option for them or for their family member. Now, while the area agencies on aging or the Aging and Disability Resource Centers continue to serve as the initial point of contact for individuals seeking services, sometimes the health and wellness and traumatic brain injury waivers, we must also be sure to provide choice regarding their case management provider. And I know we have talked about that on multiple webinars, so I'm just reiterating the importance of choice in the world of home and community-based services. All right, legally responsible individuals. So this is a reminder that spouses are legally responsible individuals and cannot be the attendant paid caregiver. So you may recall legally responsible individuals in Indiana is consistent with the federal definition and includes parents of minor children and spouses of waiver participants. And in today, LRIs cannot provide attendant care. All right. Well, an update on the health and wellness waiver waiting list. So the new health and wellness waiver year begins July 1st of 2025. Area agencies on aging and the Aging and Disability Resource Centers will continue to manage the waiting list for the health and wellness waiver. The first invitations will be of the new waiver year will be released in the latter part of July. And as a reminder, individuals can confirm waiting list placement and waiting list date on the online HCBS waiting list dashboard listed here. So you may recall recently we launched that HCBS waiting list dashboard, and individuals or their family members or representatives can go to that dashboard as long as they have appropriate information and identifiers and verify that they are on the wait list. Additionally, if you, as a provider or case manager, happen to be contacted by an individual, you can give them this information and let them know that they can go check if they would like to. If it's someone that you know and they want to share enough information with you for you to be able to check with them, or if they're with you for some reason and you all want to go online and check that for them, as long as you have that information, you can do that, and that person's permission, of course. We are really happy to be able to offer that online dashboard to improve transparency around that waiting list so that people know that they are on the waiting list and the date they went on. I will note, once an individual has been invited off of the waiting list, they will not show in that portal as on the wait list. So if an individual receives an invitation to the wait list, their name, the search for their name will not pull back a waiting list date. So once they've been invited, they're actually off of that wait list. Next slide, please. I want to take a little bit of time to talk about the Indiana Level of Care Assessment Representative, or LCAR. You may recall this is referencing a statewide vendor that will be completing nursing facility level of care assessments and reassessments for individuals receiving or seeking services through the health and wellness waiver, the traumatic brain injury waiver, and actually, we're not here today to talk specifically about the Indiana Pathways for Aging waiver, but that nursing facility level of care is applies to the Indiana Pathways for Aging waiver as well. So LCAR is that statewide vendor. If you can move to the next slide, please. And the statewide vendor for nursing facility level of care, that goes into effect just in 6 short days on July 1st. And that statewide vendor is Maximus, and they will continue work they do today called pre-admission screening and resident review, which is a program related to individuals seeking nursing facility admission. So Maximus does that work today in Indiana and has for a number of years. They will continue that post July 1. And then July 1, again, they will also begin those nursing facility level of care assessments for individuals seeking the Pathways for Aging waiver for adults age 60 plus, the health and wellness waiver, again, that supports individuals under the age of 60, and the traumatic brain injury waiver. They will do the initial assessment as well as the annual reassessment of nursing facility level of care. So the area agencies on aging and aging and disability resource centers in July, effective July 1, will no longer conduct those nursing facility level of care assessments for people living in the community to access care in a nursing facility or through a home and community-based services waiver. Now I want to talk about the exception to that. So if you're a AAA or an ADRC, and you're already working with an individual who is enrolled in services such as the Choice Program, and their needs are changing, or they will be seeking nursing facility care or home and community-based waiver services, that AAA or ADRC can do that nursing facility level of care assessment. It is essentially the same tool that is used to determine eligibility for choice, as an example. So we would, in the interest of not over-assessing individuals and requiring individuals to retell their story multiple times in a short period of time to multiple people, if an area agency is already supporting someone through choice, we could use that assessment to determine nursing facility level of care, for example, the health and wellness waiver. Now, the Aging and Disability Resource Center will no longer be responsible for completing assessments for potential nursing facility level of care assessment denials. So today, if an individual is assessed and doesn't appear to meet level of care, the ADRC would do an additional assessment. So as of July, that won't be necessary. Maximus will complete an additional assessment, and they have will conduct a clinical review, and then the Bureau of Disability Services will review that if it is a potential denial, and make final determination. Options counseling for persons under 60 who meet nursing facility level of care with a long-term approval is something that Aging and Disability Resource Centers will continue to provide for that population. I will note on the previous slide, sorry, poor Richard's running my slides and I'm bouncing around a little bit. I do want to note that for individuals age 60 or over, who meet nursing facility level of care with long-term care approval. Maximus, that LCAR vendor, will actually do or provide intake counseling for those individuals. Thanks, Richard. We can move to the next slide. Just want to provide a very high level workflow of the level of care referral process. So we'll talk some more about that, but essentially there's a number of different ways for an individual to be connected with the LCAR vendor Maximus. There is, and I believe we talk about them later in this presentation, but I do want to talk through it a little bit right now. An individual can call Maximus. They can go to their website, complete a contact form, and we'll have this information for you. They can email them. They can reach out to, for example, still the ADRC, and the ADRC can submit a level of care referral or request, actually in the system called Assessment Pro, which is the system that will be used July 1st for those nursing facility level of care for the home and community-based service waivers. Maximus will then complete the level of care assessment process, and then long-term care approval will receive intake counseling from Maximus, or if they're under 60, options counseling from the Area Agency on Aging, and then denials of level of care will be connected with other resources as needed. So if someone does not meet level of care, either Maximus or the ADRC, and even for individuals involved in pathways, the MCE can also connect them with other resources outside of waiver if they are determined not to be eligible. Next slide, please. So just a little clarification on some of the things that are changing. The level of care assessment requests or referrals. Again, Maximus will receive level of care assessment requests from really any entity, but nursing facilities, the AAAs and Aging and Disability Resource Center, independent case managers, state agencies, or even individuals seeking level of care assessment for themselves or someone they represent. Maximus will complete level of care assessments for nursing facility as well as the HCBS waiver with some exceptions. Now, I will note those some exceptions include if an individual is over the age of 60 and already has Medicaid, so they have a managed care entity. That managed care entity, because they know the person already, will complete an assessment and submit that to Maximus for review and for issuance of a determination. As we noted, Maximus will provide intake counseling to individuals age 60 and over who qualify for the waivers. And then Maximus will provide handoffs to individuals who are denied nursing facility level of care to support them in being connected to a more appropriate service. They will also provide warm handoffs for those engaged in intake counseling to connect them to community resources or next steps in the process of choosing their preferred long-term service and supports. And then Maximus will also outreach to the Area Agencies on Aging or ADRC, or even case managers based on the person's needs and circumstances. Again, all this happens July 1st in 6 short days. Next slide. So nursing facility level of care reassessments for individuals receiving services through the health and wellness and traumatic brain injury waivers. So nursing facility level of care assessments are valid for up to a year. So every year, roughly every year, an individual on those waivers must be reassessed for their level of care. That's not new. That is how it has always worked. 90 days prior to when the individual's nursing facility level of care expires, Maximus will reach out to the individual to schedule a reassessment. So if you are a provider or case manager, and I assume you are since you are on the provider and case management webinar, please remind individuals, support the individuals that you are serving, right? And let them know that they need to respond timely to that letter or contact from Maximus. That's important because those levels of care have to be done every year, and Maximus will reach out 90 days prior, so there's plenty of time there. The goal is to get that done before that level of care expires. So you work with the individuals we're talking about, and we ask that you help support them in responding to Maximus so that that assessment can be done in a timely manner. The Maximus timeline for completion of level of care is 11 days, so it's a pretty quick turnaround once they complete that assessment or get a level of care request. So please encourage the individuals you support to respond timely. We are mailing a letter today that will go out. FSSA, that will go to active health and wellness and TBI waiver participants, reminding them we've done some webinars for individuals and families too, but we are doing a direct mailing to individuals. Again, letting them know that that annual reassessment process will look a little different because case managers do that today and will not be doing that after July 1st. Case managers will continue to do all the other case management activities and actually have at least a little more time to get to know individuals and do some person-centered planning with them, but they will not have to do that level of care. Next slide, please. And here is a view of the letter that is being mailed or was mailed today. And again, it just states that starting July 1st, the individual's level of care reassessment will be completed by the level of care assessment representative vendor in partnership with the case manager, and that the case manager will no longer complete the annual level of care assessment, but will continue to provide all other aspects of case management. So in this letter, we let them know that Maximus will contact them to complete the reassessment. And then once they receive the contact from Maximus to set up the reassessment and respond as soon as they're able. We do, again, want to start that process 90 days in advance of expiration to ensure that level of care remains current and there's no gap in service to individuals. So again, as providers and case managers, anything you can do to support people in responding to those contacts is appreciated, but they all will receive this letter. Next slide. So again, after July 1st, this is just a couple items. Again, we've kind of talked about the AAA and ADRC will continue to complete level of care for those in the choice program and provide referral support for persons not in choice but needing a nursing facility level of care assessment. Maximus contacts. So this is the information I noted earlier. Again, this number can be called and individuals can request a nursing facility level of care assessment for home and community-based services. They can email in LCAR at maximus.com. And if they go to the website listed here and complete a contact form, like many websites, there's a little spot on there that says contact us, and they can click that, complete that contact form, and then Maximus will respond. To subscribe for Maximus monthly announcements or upcoming trainings, we have a link here If you are a case manager or provider, I would encourage you to check out their website, their LCAR website, and even sign up for announcements and other communications through Maximus. Additionally, FSSA has an LCAR website. Next slide, please. And the link is here. It includes some fact sheets, some frequently asked questions, and then updated information from FSSA about the LCAR program. So we will be posting and updating the FAQs as we navigate this transition. So take a look and would encourage you to visit this as we navigate through the next the transition and then the next month or so. Next slide. If you have questions, you can direct them to the BEADS Help Desk email, and an FAQ will be developed with this information, and we have that that email address there. It's beadsbds.help@fssa.in.gov. I believe many of you have probably used that in the past, so but here it is again. Next slide, please. Now some updates for providers and case managers with the CIH and FS waivers. So once again, I'm here talking about provider attestations and a reminder that the provider system administrator must log into the BEADS portal and confirm the provider profile information at a minimum of every 90 days. This is a requirement for CIH and FS waiver providers. This is a metric we report on as well. So this is a must do for providers. And I want to again go back to why we have these provider attestations. So as we consolidated our very old system Insight into the BEADS portal, and we looked at at the time, our pick list or our choice list, right? What we heard from individuals and families was the choice list wasn't accurate. Phone numbers weren't accurate, contact people weren't accurate, and it was really frustrating for individuals and families. At the same time, we heard frustration from providers that it was not easy for them to update their information. It was cumbersome for them to email us and tell us what, they need a phone number change, they need the name of a, contact changed. And in all fairness, we weren't as fast at getting that done historically as any of us would have liked. So with those two, if you will, pain points, we made some changes to the BEADS portal or enhanced it so that providers on the CIH and FS waivers could go in, update their information at any time, their contact person, phone numbers, address, even provide a little bit of a blurb about their agency that would then print on the choice list. And that would ensure that the information we and case managers are giving to individuals and families is current, up to date, accurate, and even has a little information about the provider on it. That was how we got to building that functionality in the portal. So what we've seen is that we're not seeing overall providers go in and update that information or say, we've looked at it and there's no updates necessary. Okay. Without that attestation, we don't know that it's current, which means individuals and families may be getting information that is not current and up to date about your agency. So again, this is another reminder. We have done a couple things to try to support providers in doing this. Again, it is a metric that we report to CMS. And we continue to see very low percentage of providers completing this activity. And it really doesn't take long. We are looking at other options to further incentivize providers to complete these attestations. All right, next slide. And I think this is where I am going to go off camera and be quiet and turn it over to our division Chief Operating Officer, Jessica Harlan York, to give you some great information about the HCSP training.
Thank you, Holly. Glad to be back on the provider webinar. Welcome. And just going to share a little bit of information about the Home and Community Support Professional Training and Registry that hopefully all of you have heard about. We've sent some information in the last couple months. This is legislation that was passed almost about 2 years ago, Indiana Code Section 121116, and this requires DDRS to develop and implement a tiered training certification program for Indiana's direct service workforce and a statewide training registry. The term home and community support professional, there's a lot of background here. There was much work done by DDRS and other stakeholders across the state of Indiana, really looking at the direct service workforce in Indiana and what has been going on over the last couple of years that's good, and some challenges and things that we can improve. So with that this legislation came from that, and part of that is defining the home and community support professional. And this is utilized to denote a trained professional who supports and partners with an older adult or a person with a disability to provide person-centered support across a range of home and community-based settings. And I have a couple citations here. The Indiana Code 121116, as well as our 460 IAC 6318, that is going to provide further clarification on what an HCSP is and the exact services that are impacted. And this is direct services provided to an individual. The next slide will also go into this, but the only requirement of this legislation is services under CIH and FS. Those are the only required services. So if someone is providing direct services related to those waivers, this is applicable in terms of the requirement. And again, the goal of this really is going back to having a training program that's portable across HCBS settings and ensuring that employment arrangements, that there's quality and reliable supports and services for individuals that we support, as well as creating and increasing administrative efficiency. Next slide. This will launch the platform and the training in the platform, will launch officially on July 1st. Again, I want to make sure that it's very clear. This is required for those direct care services under the Family Support and Community Integration and Habilitation waivers. That's who it's required for. So if you're providing a service that is not under one of those two waivers, it is not required. This mandatory training curriculum consists of 2 curricula. There's a foundations and a fundamentals curricula. You have to complete the entire, there's multiple modules within those curriculum, but you have to complete all of the modules to receive the certification. So those modules are things, related to, person-centered planning, communication, things of that nature that would be applicable across different types of services and supports under the home and community-based settings services. The certification for all the HCSPs, and this is regardless of length of employment, must be attained by January 1st, 2026. So again, that platform is launching on July 1st, but you would have until January 1st, 2026 to complete the certification. And so there's a little bit of, there's some nuance here with the date. So I just want to give you an example. So for example, if you're hired post July 1st, right? So we're asking that you have a goal to begin using this platform by August 1st, right? So it's going to launch on July 1st, but we're giving providers, a month or so. You can go ahead and start using it on July 1st, but if you want some time to get accustomed to the platform, You're going to be getting into that in the next week, but you want to take some time, right, to get accustomed to it. You wouldn't be required to start using it until August 1st. The January date comes in because then that's giving you time to catch up those staff that we know a lot of you have many staff, right? You're not going to necessarily be able to train everyone in a month. So that January 1st is giving you that time to be able to have your staff trained in that platform. Again, please note that could mean staff are completing 2 trainings. So you might have a newer staff that starts July 3rd and you're going to train them, in your using your current platform. While they're going to then need by January 1st, technically try to start by August 1st, they need to be utilizing this platform. So again, there's a lot of dates in there. I know that can be kind of confusing, but we want to, we heard back from stakeholders about just the concern of the timing. So we wanted to make sure people had some time to get into the system and become familiar with it and ask questions, etc. Next slide. Thank you. Just again, making it very clear that every HCSP has to take this training no matter how long. So even if you've been a DSP and HCSP for 25 years, you still need to take this training initially. There is no, if you've been a DSP 10 years, you can just opt out. There is no opting out of this. This is a training that you have to take. There is not a cost to an individual or a provider if that individual is an HCSP providing one of the applicable services under the CIH and or FS waiver. So again, that's the required. So if you're required to do this under this legislation, there is not a cost to you in terms of buying the platform or anything like that. It is a platform. We have a contractor that we're working with. And so this will not be a cost to you. This training meets the requirements for DSP training in 460. So there's a lot of requirements under 460, as you know, around being a direct support professional. This does cover those trainings, and you'll see that once you're taking the trainings. You'll be hopefully pretty familiar with the things that you're going to see within this training. Next slide, Richard. The total anticipated duration of the full training is no more than 8 hours in foundational and no more than 8 hours in fundamental. So again, that's approximate. Some people, it's not going to take more than 8 hours. I don't know that it'll take someone 8 hours either to take the training. That's just an approximate, wanted to give you an approximation of what the amount of time it could take. Each provider organization will have an administrator account. So right now we are, as Holly mentioned, what is very important is, as she stated, using the provider attestation. So we use that information to also contact providers. So we've used those email addresses that you tell us, who are your administrators. We're actually using those to contact all the providers, the applicable providers that this is required for, to set up administrator accounts for this training platform. So we sent out a survey last week to gather that information just to make sure that we have, everyone's emails correct. And then this week, an email will go out, giving more information about getting registered in that system. It'll have guides on what the system, navigating the system, as well as getting your employees registered as well. So tons more information coming out, but we use those email addresses to match up and make sure that the information we have is correct. This training link sorry, Richard, just go back one more. The training link and registry link will be located on the main DDRS page. It is not there yet because it is not July 1st yet. So, but it will be, the link will be there on the main page, and we'll send out some announcements and everything about that as well. The certification, so after you're required to take these trainings, and then you obtain an HCSP certification. And so that certification will be on a public-facing registry that is, again, as I stated, public. So anyone can go in and they can see, Jessica Harlan York received her certification on this date. It's not a hiring platform. It doesn't have any personal information about that person. It just states that they passed this certification. And it has the date, and that's, there's not a tons of information in terms of personal information about that person. The HCSP has to work for an enrolled provider. Self-directed services will require HCSP employment through a fiscal intermediary. And I want to stress this too, the job title is not really what's important, it's what the person does. And so are they providing, do they or will they provide an applicable service under the CIH and or the FS? And so, someone says, I'm a supervisor, but is it possible that you would ever provide a service? So think about the training you do now, that person would receive training, right, on direct support. It's the same thing. So it's not, so just think about that when you're thinking about titles and who would be required to take this training and obtain the certification. Next slide, Richard. Oh, that's it, I think. And we're actually getting ready to release a FAQ as well, which will address many more questions that you have, but you guys are always welcome to email beads.help. We've gotten a lot of information and questions from that as well that are helping build our FAQ. Thanks, Holly.
Thanks, Jessica. Appreciate that information. It's really good information. Very exciting. Very exciting. All right. Let's jump into some questions and answers that we have received, and we'll go through those. These are from May. First is, when a PCISP or person-centered individualized support plans units were not updated correctly on a change in provider, what is the process to get them corrected to what was used? So it is the responsibility of the team to address service utilization prior to final approval of a transition. And when we say transition, we're talking about that change in provider referenced in the question. It is the responsibility of the current provider to disclose accurate utilization of service as part of the transition process. It is also the responsibility of the case manager to verify the accuracy of the information provided prior to completing the transition. If there is a case where the units are not updated correctly, the case manager should work with the providers to resolve the discrepancy and may involve the BEAD service coordinator from the district office to seek resolution. Okay, we have a behavior consultant who is getting ready to go on maternity leave. We're wondering if a BC can simply inform their clients of their leave, for example, 6 weeks, and then return to the caseload as usual, or do alternate arrangements need to be made? What if we don't have the staff to provide coverage? So this is a good question. The answer is that the service definition is written so that the provider of the service is responsible for all of the activities and limitations within the scope of the service definition. If an individual's clinician is absent or otherwise unable to meet the individual's needs temporarily, the provider of record is responsible to offer either finding another clinician who can temporarily assist in providing support and or providing a 60-day notice to terminate their role as a provider. The individual may choose to temporarily interrupt services, but that should be the individual's choice as documented from an interdisciplinary team meeting. Again, the individual should drive what happens from there, but ultimately the provider is responsible, not actually just the BC. Next slide. Is there any rule that limits providers from soliciting from the waiting list? I have been told by many people that certain providers are reaching out to them that they never contacted. So the purpose of the waiting list dashboard is for enrolled providers to verify an individual's placement on the health and wellness or pathways, Indiana Pathways for Aging waiver wait list. To create an inquiry, the provider must have basic demographic information about the individual. If you have a concern regarding possible misuse of the dashboard or any DDRS web-based tool, please submit your concern electronically to the BEADS help, bds.help@fssa.in.gov. Is there a specific requirement or regulation that mandates a provider must employ a QIDP, which is a qualified intellectual disability professional, or and that the QIDP must sign off on all work completed by program coordinators. So 41060 or 410 IAC 16.2-1.1-55 IDOH and CMS guidelines require the use of a qualified intellectual disability professional or QIDP. The QIDP must sign off on all work completed by non-QIDP employees. And back to the previous slide in question 4, I will say in our question and our response is related to those services BEADS provides for individuals with intellectual and developmental disabilities. Okay, so a QIDP is not needed if we're talking about services through the health and wellness, for example, waiver. Next slide, please. Okay, and this is another question that we received. Just wanted to make sure that OIG, that's Office of Inspector General reports, are still supposed to be done every month on all employees. We have been doing them every month on every employee. This seems like a lot, and we wanted to clarify. So we are referring to the Office of Inspector General exclusionary list, which is located on page 207 of the DDRS HCBS waiver provider reference module for requirements. So please take a look there, and you can bookmark that page so that you can be sure to be in compliance. I will note that when there are audits, that OIG, whether or not providers have checked that OIG exclusionary list and documented that, is a point that is reviewed during audits. So it's very important that there's clarity around that and that providers meet that obligation. Next slide, please. Okay, future webinar topics. I actually saw an email come in when Jessica was talking about a potential topic. So thank you to the sender. Again, we are doing these monthly currently, and we really want these to be worth your time. So please let us know. Send us an email at beadsproviderservices@fssa.in.gov with any topics you would like to see covered in a future webinar, and we would be happy to do that. Next slide is just a big thank you for sharing some of your day with us. We know everyone's busy, and we appreciate your time and look forward to talking with you in the future. Have a great rest of your week.